I'm excited because we're still doing our Q&A session. So today's question, taught candidiasis the other day, and that she went to the hospital to go check it out. So the question was, Doc, I'm just going to say how she said it. Doc, this thing that they put inside me, I felt like they didn't get it well.
Hold up.
What is your opinion? Okay, so I don't know what they had put inside her, but I'm assuming it's this thing now. This thing that is on your screen. I'm assuming that's what they put inside her, in order to get sample for tests. So this is called a swab stick. Okay, so most people, and that is aka toilet infection. Okay, so most times when you go to the hospital, some tests will be done, and then one of it is high vaginal swab or endocervical swab. So those are like the two major tests that may be done in that kind of case. Okay, so most times, yeah, a lot of people do not know how to collect the sample.
Will you shut up your dirty mouth?
This one, a whole lot, including health professionals. You go for a high vaginal swab or an endocervical swab, and somebody brings this thing that you're seeing now and shoves it into your vagina just like that. My sister, get up, wear your panties and go. The person is doing the wrong technique. This is violating you. That's not the right technique. So the right thing is that you'll be taken into a room. Number one is that your consent is supposed to be gotten.
You get it?
Yes, in order for
If you don't
somebody
get it,
to
forget about it.
take that sample, you're supposed to be educated on what they're about doing. The doctor should be able to tell you, this is what I'm about doing, okay, or this is what I'm going to refer you to go and do, okay. And then before they even start it, they're supposed to get your consent. It is very valid, verbal or written, but most legal one is written. So you'll be taken to an examining room where you'll be laid on an examination couch.
In the presence of a chaperone.
Totomy. And that's the position you'll be placed. And when they place you on that position, your legs will be spread out. So this hair, you're seeing it now exactly. So this is what we call the totomy position. That's how you'll be placed. Okay. Meanwhile, as you're going for that, they will tell you to remove your panties because you're not getting panties and they'll be doing that for you now. So you remove your panties. That area would be cleaned. If there is any soil there, they'll clean up the area. And then your vagina will be exposed properly with what we call speculum. It's written here. Speculum. Okay, so most times we like using Costco speculum. Sometimes we use grapes, okay. A speculum will be put inside of female area so that the doctor or whoever that is collecting the sample can visualize the area very well and know what they are collecting. The person would be as gentle as possible. So believe me, it's not painful. You're just going to feel like as if a penis is just entering you, but this time around it's going to be more like a plastic one. Okay, most times it's always encouraged to use disposable plastics, but in a good environment, once the other type of speculum is sterilized, that's fine. It can be used on you. Okay?
Some people will feel some kind of discomfort.
But in order to ease my patient of all that discomfort, I like to apply some lubricant on it and then gently insert. Okay, once that has been inserted into your vagina, it will be opened up, and so that area will be properly visualized. They cannot take that swab stick, that thing, hair, they'll carry it and gently put inside and collect. If they're going for an endocervical swab, so they're going to go for your
external os.
That picture exactly, that opening, that's where they're going to go and collect it from. Or if they're going for a high vaginal swab, they're going to go into your posterior fornix. So the vagina has a place that is called posterior fornix. That's the place they will go there and can pick it. After picking it, they will make sure they are very careful that they don't rub it on the side, because once you pick that sample, make sure you don't rub it anywhere around that area. Gently bring it out. That is why you as a patient, you can't do it on your own. You need somebody to do it for you. And you need somebody that is well trained. Okay, so once it comes out, you try as much as you can so don't contaminate it with the environment. They will not gently insert it back into the container. Once they insert it into that container, good, that's fine. They can now go and submit it. I'm also assuming that you see that's your vaginal swab stick. that it has already been labeled before all this thing has happened. Okay, so that is it. It's as simple as that. If anybody has not gone through this procedure step by step, do not allow the person to come close to you. Tell the person is not doing it the right way. And if you don't collect the right sample, you are just going to expose that patient into taking multitude of drugs that would not even help her in her condition. However, if you are a virgin and you have those symptoms of candidiasis, aka toilet infection, you do not need to go through that. They'll probably give you some topical drug, that's an ointment that you're going to be applying at that area. There won't be any need for swab stick or anything, okay, so that nobody tampers with your hymen until when you're ready to. Okay, so thank you guys for this particular question. I hope you guys learned a lot. I'll see you next time.